So we're just going to jump right into it if y'all are okay with that. These are my dogs. I would like you to bask in their glory. This is Fergus. He's a 10-year-old male neutered Old English Bulldog. The little brown one is Odette. She is 3.5 French Bulldog. And they have pretty much every classic medical problem that a flat-faced dog might have. So they're an excellent example for us to chat through some of this. They're cute, aren't they? Yeah. So flat-faced dogs, the medical terminology for that, or the anatomical terminology, it's called brachycephalic, which just means short head, short face. And so in the medical community, we just call them brachyes. So if somebody that you're talking to, your dog is at the hospital and they're like, oh, you have a brachy, that's what we mean, a smushy-faced dog. And although it's really adorable, it does come with some anatomical consequences, some issues with how they go about their lives that dogs that have a longer nose might not have. There's a lot of different breeds that we consider brachycephalic, and some of them are unexpected. A lot of people don't know that boxer dogs are considered brachycephalic. They have smushy noses. Pekingese and Shih Tzus don't usually typically fall in with like the pugs and the French Bulldogs and the Old English Bulldogs, but they are brachycephalic too, and Cavalier King Charles Spaniels actually. Yeah, you don't think of those as a smushy faced, but they count. Yeah. Because I'm a doctor and I like medicine, there are some pictures of medical things that are going to be shown in this talk. If eyeballs gross you out, I'll warn you before we see the eyeballs. If skin grosses you out, I'll warn you before we see the skin stuff too. So just some examples of brachycephalic breeds. The pugs, pit bull terriers, or American Staffordshire terriers count, boxer dogs. This handsome gentleman in the middle is one of our other doctors' old man. His name is Norman. He's a Pekingese. He's deceased now, but he used to go adventuring with her all the time, and he had paralysis in his back legs, so he had a off-road four-wheel cart that he would go in. You can see his wheels there. Norman. And we try to include him in every lecture as a rest in peace, because he was an amazing guy. So I figured I didn't want to overwhelm you with everything that can go wrong with these dogs because they're so popular and we love them, but I figured just giving you some highlights about 3 things that we commonly deal with in veterinary medicine for this particular subset of breeds. But I wanted you to know everything, so I made you a list. Everything that's big and bold are things that we're going to talk about today. Everything else are things that these types of dogs are overrepresented in the medical sphere for problems that they might have that may be directly related to their shape and their size and their breeding. And if y'all find this interesting, maybe we can pick some of the other topics for lectures in the future. Brachycephalic obstructive airway syndrome is a huge one. And this is directly related to the way their faces are flat, so we're going to talk a lot about it. They can get inflammatory bowel disease, so it makes them very sensitive to foods that their body might react to, so we have to be very careful about diet for many of these dogs. And if you're pet sitting, make sure that you know what treats are acceptable and what treats are not acceptable if they have inflammatory bowel disease. That's super important. They can get intervertebral disc disease, or IVDD. That's where the discs between the vertebrae in their back will get weak and they'll bulge out and push on their spinal cord. And it can cause back pain, and it can cause weakness in the back legs, and in severe cases it can cause paralysis, sometimes in all 4 legs. So if a smushy-faced dog doesn't want to jump up on the couch, if they're not as interested in going for their walks, if you pick them up and they cry out, those are all signs that could indicate back pain, and it could get worse much quicker than other types of back pain. So you want them to see a doctor right away if you notice signs of back pain in your smushy face. Jumping up and down off the furniture is often the first thing that families notice that they don't want to do. Chronic regurgitation, we'll talk about that. That's related to their brachycephalic airway syndrome. They can get hiatal hernias where their stomach can move through the diaphragm, and that can make them really burpy, and sometimes they'll bring up their food when they're burping. They have tons of allergies, environmental, food allergies. They can be seasonal or all the time. They can have medication allergies too. They often have a lot of orthopedic problems. They're born with abnormal hips and knees, which can affect their life in the long term and make them more prone to developing things like arthritis. Their teeth are terrible. Yeah, they're just smashed, and there's not enough space in their mouth for their body's normal tooth cleaning mechanisms to work. So we fight a lot of dental disease in these friends. They get ear infections, they get seizure disorders, et cetera, et cetera, et cetera. And they have eye problems because their eyeballs stick out. And so they're at risk for trauma. They have tear production problems. Yeah, so we'll go through brachycephalic airway syndrome, the skin problems, and the eyes today. So what is brachycephalic obstructive airway syndrome? What that means is their skull is so smushed that their sinuses are not normal, their tongue is too big for their mouth, their trachea is underdeveloped, and there's so much tissue back there because of their palate and the swelling of their larynx that it's difficult for them to move air. So these are the signs that mean an animal has brachycephalic obstructive airway syndrome. And we say that 97% of these breeds, especially Frenchies and Pugs, will be born with brachycephalic obstructive airway syndrome. So that's the majority of the population has this problem. And then it's graded on severity. You'll notice some skulls on this picture. The one on the right, the one on the right is a pug, and the one on the left is a Labrador Retriever. So you can see the difference in their skulls and the smushiness of their faces. And on the internal anatomy, this is looking at the dog down his throat. This is his soft palate. It should be this long, and in a smushy faced dog, it's 2 to 3 times the normal length of a palate. And that gets stuck over the airway and makes it harder for them to breathe. They have tonsils here too that get really swollen, and they can pop out. They're called everted laryngeal saccules, so that makes the airway even smaller. Their tongue is way too big, and their tracheas are often really, really small. So that's a lot of things happening in a small area to affect their breathing. And really the bottom line of brachycephalic airway obstructive syndrome is that they can't breathe, and we need to try to help them with that. So the consequences of this anatomy problem, they're very heat intolerant, and they overheat super quickly. We're going to talk a lot about that because it's something that I see in the ER all the time as an ER doctor. These dogs come in overheated and respiratory distress. They have swallowing problems because there's so much stuff in the back of their throat. It's hard for them to get the food back, to breathe at the same time, and not choke or cough. They also have swallowing problems. And a lot of them will just regurgitate. They'll drink water and then burp it all up. They'll have their food, go run around, and then bring up all of their food. So this is my dog again. This is Odette. I would like you to listen to her. She's had surgery for brachycephalic airway syndrome. So, so that sounds really harsh and phlegmy, and she has to hold her breath before she goes and gets that ball, because once the ball is in her mouth, there's no space for her to breathe. This is her falling asleep with her avocado. Oh, I don't know why the sound's not working. Oh, there it goes. That's how she sleeps. That's how she sounds when she's sleeping. Yeah.
For these kind of dogs, since they have a hard time holding like a toy that doesn't have kind of airflow, do they ever get balls that have like those cutouts in them?
Yes, okay. I love that you asked that question because I was going to bring it up.
Okay.
So she no longer gets stuffies and she no longer gets hard balls. She gets Chuck It Air Pro, and it's an orange rubber ball that has holes all through it. And so she can grab it and she can run with it and chew it and she can still breathe. Yeah. She used to love tennis balls, but she almost died too many times with tennis balls. So then we started to experiment and we found the Chuck It Air. Yeah. And now I just buy boxes of them on Chewy. She goes through a lot. This is her right after dinner, and this is our after dinner ritual. That was her old man burp. Did you think it? Do you want to hear it again?
Yes.
Good. Let me see if I can get it to go ahead. Oh, the sound is delayed. I don't know, I'm not good with technology. So if we don't stop after her meal and have her stare at me and do this burping behavior, she will run around, play, try to burp, but bring up all of her food. And so she has had 2 episodes where she choked on that food. And my husband was home one time, he's not an ER doctor, he had to give her doggy Heimlich to save her life because she regurged a whole bunch of her food. The other time I was there and I was able to do it, but like, you know. So she gets hand-fed, tiny pieces of food. It takes 10 minutes to feed her every time we feed her. And then it takes another 5 minutes for her to do 2 burps afterwards. And she knows that she has to wait in the kitchen, she has to look up at me, and when she burps, she gets free and she can go and play. All of that is brachycephalic obstructive airway syndrome. So the only reason why she has those problems is because she was born as a smushy-faced. So there's some things that we can do to try to help and maximize their quality of life even though they're born with this weird anatomy. We actually do surgery on these friends. We do surgery to trim that overlong soft palate. We give them a nose job. We open up their nostrils so that they get better airflow through their sinuses. And if we need to get that tissue around their tonsils that's swollen, we take that off too. So this is Odette right before she went into surgery. She's asleep right now. She has a breathing tube. It's the best she's ever breathed for her entire life. And you can see how narrow her nostrils are. Her little nose is so pinched, right? And here she is at home before surgery. Her nose is so pinched, so narrow. If you think about her nostrils compared to a dog that's not smash-faced, there's practically no hole there for her to breathe through. She's pretty though, isn't she? Look at her eyes. She's so pretty. And here she is immediately post-op.
Oh, wow.
So look at how much bigger her nostrils are.
Yeah.
And she's still pretty.
Yeah.
This is Fergus. He's old man and cameras weren't great back then, so I tried to find baby pictures of him, but I'll point out his nostrils. So there's one little slit there and one little slit there. He was so bad that he wouldn't sleep. He would just take cat naps when he was a baby. He'd put his head on us, sleep for 5 seconds, and then wake up because he wasn't able to breathe. And this is him again before surgery. His little nostrils. He's so handsome. He's my baby boy. And then this is him post-op. So you can see the nostril is probably 3 times the size that it was before. And he had all this done when he was really young, so that's why the quality of the pictures is poor. Because their faces are so smushed and because there's so much tissue in the back of their throat that limits airflow, they don't have the normal dog cooling mechanisms. So when a dog is panting, it's bringing tons of air over its nose, its sinuses, and all of that gum and tongue tissue, and that cools their whole body because there's so many blood vessels in that area of the face. If you get air movement over them, it's like the best AC unit you can possibly get. These guys don't have that because everything is smushed. There's no airflow, less airflow. The airflow isn't as strong or fast. So they don't have the normal and natural dog cooling, which is a huge problem and makes them very sensitive to heat stroke. When they're doing that heavy panting, because they're trying to cool themselves down, they're causing a lot of friction in the back of their throat with all of that abnormal tissue, and that friction causes swelling, and that swelling makes it even harder for them to breathe. And you can have a totally happy, normal Frenchie, and 5 minutes later you have one that's in respiratory distress because it got too hot. Yeah. So we try to keep them cool, and if you start to see that they really have a big, wide, flat tongue, they're really making a lot of noise when they're panting, if they're holding their ears back against their head, if they don't want you to touch them, or they're laying flat on the ground with their belly out, that dog is too hot. So we need to cool it, and we need to get it to a doctor so that we can give it some sedatives and manage its breathing. So that's an emergency situation for these particular types of dogs. And the faster you get them in, the faster we can help them, and the less likely it will be that it could become life-threatening, but it does become life-threatening pretty quickly. So, what can we do? We avoid exercise and really long walks. My cutoff for my dogs is we don't go outside if it's more than 67 degrees, which feels really cool, right? But if it's 70 or over, an average dog on a walk will be panting. And we know that dogs that are hot are panting. Frenchies that get hot pant too much, and then we get into trouble. Limiting their stress and anxiety. As an ER doctor, I see dogs that have gone to their groomer to get their nails done and got stressed out, worked themselves up, got into a respiratory crisis, and then show up at the ER afterwards. So if your dog is well socialized, likes to be around people and other dogs, is okay in the car, start them early because they get stressed in the car. Start them early on understanding that the veterinary hospital is not a scary place, so go in for treat visits. A lot of our primary care doctors will say, bring your puppies in and we'll just all love on them and give them cookies so they're not afraid. Make sure that you're touching them everywhere so they don't get stressed out when you're touching their feet, cleaning their ears. Try to do their toenails at home when they're babies so they're not scared or worried about that. The less stressed, the less hot, and the less fat we can keep these friends, the better they're gonna breathe. Odette for a little while was not able to exercise because she was having a lot of health problems. She got a little fat, and I noticed that her breathing was much worse when she was fat. So now we keep her lean, and my mom is like, your dog is too thin. I'm like, no, your dog is too fat. It's a little family fight. So some ideas, and if you guys want a copy of this, it's one of our community support resources, ways to cool down a dog. We never want to dump the dog in water because if you cool them too quickly, you can actually make things worse. But you can put cool water on their belly. You can put cool water on their ears where they have a lot of blood vessels, the top of the head, on the pads of their feet. But you don't want to dump the whole dog in water. Fans are fantastic. So if they're hot, you can put water on their belly, put water on their head, put water on their feet, and put them in front of a fan. Make sure that they have water available all the time, but you don't want it to be ice water. Just room temperature water is fine. Yeah. And if they like frozen treats, you can do that, but a lot of times the brachycephalics, they like them, but then they get a lot of mucus and they've been licking a bunch and then they can cough and gag. So you have to decide on your dog whether or not you feel okay with that. So is it next week that we have another heat wave?
Mm-hmm.
Yeah, keep them cool. Keep the smushies cool. All right, moving on. Wait, do you have any questions about brachycephalic obstructive airway syndrome?
Yeah, I have so with the pads of water, you're saying, can you just put like a washcloth on their pads and like a little washcloth on the top? We're not talking like trying to dunk them under,
Yeah.
or just cooling them down, like giving them some like tactile cool relief, putting them in front of a fan.
Yeah, don't dunk them in the water. And don't leave a wet washcloth on their head because that's actually insulating, so you just squish the water on them or splash the water on them.
Okay.
If we were having a talk about working dogs, like shepherds, like canine officers, they're actually training those dogs to dunk their whole head in a bucket of water voluntarily to cool them quickly, because there's a problem with overheating and heat stroke in working dogs in the summer. But we don't want to teach our Frenchies to dunk their heads in a bucket of water. That doesn't seem like a good idea. So skin problems. So they are exquisitely prone to allergies. I have grains, there's pollen, bees, anything that a human could be allergic to, our dogs can be allergic to, and the smushy faces are overrepresented for that. They also get wrinkle infections. I'll show you some pictures of that, because they have those facial skin fold wrinkles. They often don't have a whole tail, but they have a little bit of a tail, and there's some skin folds associated with their tail. They can get yeast infections primarily because it's a warm and moist place where yeast likes to grow. My dog, Odette, has inflammatory bowel disease and it's quite severe. And she can't have anything but soy protein. If I give her like a pork treat or salmon, she just breaks out everywhere, has diarrhea. So, They also get something called hyperkeratosis. Have you all ever heard of that before? Yeah. The skin on their pads and their nose grows thick and it grows too quickly. So they have really weird stuff. I'll show you pictures, stuff on their nose and their pads. So this is Odette again. She's my poster child. This is her this summer. She's having a breakout of her seasonal allergies. So you can see all these little red bumps on her inside of her leg, and there's little crusties. We don't know what she was breaking out with, but she was having a nasty breakout. They can get little skin infections along with the skin allergies. And in severe cases, it can actually really impact their quality of life because they're so dramatically itchy. All they want to do is itch themselves, and they can damage their skin further by itching. For many dogs, we can use combination therapy for these allergies, and we can be quite successful. A lot of them get antihistamines. Odette gets Zyrtec every day. But some antihistamines are not safe for dogs. So if you're going to use an antihistamine, make sure that you get approval from their primary care so that you know what's safe for them. We also have some immune therapy. Just like humans with bad allergies can get allergy shots, we can do that for dogs too. They can get the shot version, or they can get an oral drop that's tailored specifically to what they're allergic to. And veterinary dermatologists are the ones that put that together. We also have other immunotherapy that their primary cares can give them. It's called Cytopoint. It's a once-a-month injection that's been shown to help with the itching associated with allergies. Odette gets it. And there's some other daily drugs like Apoquil that can help with allergies. So if you think that your dog might have allergies, it's something that we're getting much, much better at treating in veterinary medicine. So check in with their primary care or dermatologist, and they can help them feel better. This is hyperkeratosis. You can see all the little crusties on her nose. And then most paw pads are nice and smooth, but you can see all this feathering. That's just the skin of the paw pads overgrowing. It doesn't hurt her at all. It makes it a little bit hard for her on slippery surfaces because it's smooth and but I can't deal, so I put nose butter on her all the time because I can't look at her face with it like that. I have to clean it. Yeah, so there's some topical products that you can use, or if they go to a groomer, we can actually use a little Dremel to shave the paw pad areas down a little bit, but it doesn't hurt them. It's mostly just unsightly, or if you're me, it's unsightly. This is Fergus's tail fold. I don't do manicures, so please ignore. You can see how red it is, and this is the pocket, so his tail is right here, his butt's right here, and then this is the pocket that's infected. And then Odette has wrinkle infections on the side of her face. So the whole side of her face is red. My dogs are a mess, aren't they?
They're worth it.
They're lucky their mom is in bed. What did I get myself into? So there are some products that you can use that are over the counter that you don't need a prescription for that are very safe to try to manage some of these mild skin problems. Wrinkle wipes, I should buy stock in this company because I use so many wrinkle wipes. They have an antifungal to help with the yeast, and they also have an antibacterial component to help with skin infections that aren't yeast. And pretty much we do this every day. It's part of the routine. In the morning, they go out, go potty, they get breakfast, they get wrinkle wiped, and then at night before bed, everybody gets their drugs and they get wrinkle wiped. And that actually really helps to maintain these infections that can be quite itchy and uncomfortable for them. So they can impact their quality of life if they get out of hand. Eye problems. Do you have any questions about skin before we talk about eyeballs?
Do you ever use coconut oil on the
And the hyperkeratosis?
Yeah.
The coconut oil, we don't know actually if it really helps. It's not going to hurt anything unless they're eating a whole bunch of it. If they're licking a bunch off, it's pretty high fat. That can affect their dietary system. I use vitamin E. I just get the little vitamin E capsules and I clip the top off and I just put a little on my finger and then just rub it on her nose.
Okay.
Yeah.
Thank you.
Yeah. I don't do it on her paw pads because it would be just a mess.
Yeah.
But the nose, the vitamin E can help.
Are there dietary considerations to do for managing some of these skin and
Prescription diet? Yeah. Yep. Yeah. Thanks for that. Prescription diet can be helpful if they have food allergies or food sensitivities. It doesn't really help with environmental allergies. But most of the foods that are actually proven to help are by prescription, so your veterinarian has to prescribe them. Odette is on hydrolyzed protein soy diet, and that's all she gets. She gets sweet potato for her treats, but yeah. And the diet thing is very specific. You have to figure out what's going on with the animal. You have to have a planned diet trial. You need a good source of it. So that should be veterinarian driven. There's a lot of like grain-free diets on the market, but that doesn't mean that they're safe for dogs that have grain allergies. Yeah, thanks. What else? Good. Eyeballs. Dry eye is really common in these friends. Because of the shape of their eyelids, they often don't get them to cover their eyeball every time they blink. And that can lead to problems with their tear production, which leads to dry eye. And dry eye in itself can cause a ton of other issues with the eyeball itself. It can lead to ulcers on the cornea. It can lead to problems with the pressure in the eye. Yeah. So KCS is what it's called, dry eye. So if you ever hear a dog that has KCS, we can treat it. We can treat it with ointments. We can treat it with autoimmune treatments because sometimes there's an immune component to that where their body attacks their tear cells. Yeah. We can see cherry eye. Have y'all ever seen a dog with a little red thing on the corner of his eye? Usually, yeah. Cherry eye is really common. I've got a picture of it. The flatter the face, the more likely the eyelids will have a problem with one of the tear glands popping out. And it looks traumatic and scary. And it can lead to dry eye, but it's not painful for the animal. They get ulcers because their buggy eyes are just out there and they can run into things or get sand or dirt in their eyes and it scratches their cornea. And then they just get general inflammation and infections of their eyes, which is conjunctivitis. I didn't pull out any really gross pictures because I didn't want to freak you all out, but these friends often will pop their eyes out if they get into a fight with another dog. It's called proptosis. They'll just pop an eyeball out. Or if they are like very, very stressed on a leash, sometimes they'll pull too hard and increase the pressure to their face and then pop an eyeball out. We see that a lot in the ER, but I didn't put any pictures in it because it's not a horror show. It's a veterinary lecture. They also get something called nuclear lenticular sclerosis. If you've had an old dog and you notice their pupils look a little bit gray or cloudy, that's what this is. It is not a problem. It's an aging change that we expect to see, but it can be an early indicator that perhaps that animal is more prone to cataracts that could cause blindness. We don't treat it directly, but we think about it and note it when we're doing their physical exams. Okay, you ready for eyeballs? Mm-hmm. This is your trigger warning. So this is not my Frenchie. This is a little one that came in through the ER for eye redness and mucus. You can see how red that white of the eye is. That's a sign of inflammation and irritation. You can see crusty mucus. You can see hyperkeratosis of the nose, which is just unrelated. There's a lot of gunk all through here, and the eyelid margins are really red. Like that dog has been rubbing its face because it's uncomfortable. So this dog has dry eye, so KCS. That dry eye has led to ulcers on her cornea and conjunctivitis, which is inflammation of the tissues around the eye, all that redness. This is a cherry eye. So dogs have a third eyelid. You've probably noticed it in the corner of their eye. It's called a nictitans or nictitating membrane. And there's a tear duct and a tear gland that are tucked underneath that third eyelid. And because these friends are smushy faced, there's not enough room in their bodies for all of their organs. And there's not enough room in their eye and around their eye for that gland. So if it gets inflamed at all, it just pops itself out from underneath the eyelid. Sometimes they just go back in on their own. Sometimes we have to massage them back in. And in severe cases where it's bothering their vision, it's really swollen or it's irritating for them, there is a surgery that we can do to tuck it back underneath the eyelid. So next time you see the bulldog running along the street and you see those weird red things on its eyes, that's what it has going on. This is the same Frenchie in the first picture, and I'm just showing you the ulcer has gotten so bad that now it's a little swollen part of the clear part of her eye, the cornea. That ulcer is at risk for rupturing or popping. And if an ulcer of the eye pops, then that is an eyeball rupture, and we don't want that. That's a medical emergency. And dogs that have an ulcer that has popped require care by an ophthalmologist on an emergency basis. If we're going to try to save the vision or even save the eye, sometimes they pop and we can't save the eye, and then we just have to take the eye out, which dogs do fine with. They don't care. Like, you know, they don't have to see to drive. They recognize their humans by smell, so even if they're totally blind, they'll still know their families. This is Fergus again. He's 10 now, so he's got, I don't know, the color. Can you see that his pupil looks a little gray? Yeah. That's the nuclear sclerosis that we were talking about. He doesn't care. It doesn't bother him. So when we're thinking about what we can do for these little ones, because everybody loves them, they're really great dogs, fantastic. And we want to have them, but we also want to make sure that we're taking care of them appropriately because they do have so many genetic issues. They should get a primary care as soon as you get the dog, whether you're adopting them, whether you're getting a baby from a breeder or even from another family member. Establish the time that you're getting them or even before a relationship with a primary care doctor, so you know who to go to if you have any questions, if you have concerns, and so that the doctors know that animal and can track them for the rest of their lives. I would also add, know where the local ERs are around your house in case there's a sudden emergency. Or if you're traveling, when I travel with my dogs on our route map, I ask Google to give me all of the 24/7 ERs so that I know where to stop if something's going wrong. It's not paranoia, it's preparation. And then if you think something's off, take these dogs in. You know, nobody's ever gonna get mad at you for showing up and everything being okay. Early is better because they're stoic and they live this way their entire lives. So they're just gonna go about their day, right? Like Odette, after we had to resuscitate her when she was choking, she went to go get her ball. Like, she woke up and was like, oh, where's my ball? They won't take care of themselves, and so we have to take care of them. Early is better for veterinary care. Skinny. I want to see these dogs skinny. The fatter they are, the harder they breathe, and the more prone they are to heat stroke. Keep them lean, keep them cool, stay inside. AC, water available all the time. I saw a man running his boxer on Monday when it was 90 degrees. And I stopped and I was like, hey, can I give your dog some water? He was like, oh yeah, thanks. I didn't tell him that I was an ER vet and that I wanted him to get my card because we're probably gonna see them at the ER soon, but I did give the dog some water. Yeah. And then have a financial plan. I know we just met. Can I give you guys some TMI? Yeah. I just happened to look at my dog's bill, total bill the whole time that I've been a veterinarian at Dove Lewis, with insurance that pays 90%, keep that in mind, and with my veterinary discount, my total bill for the past 9 years for my dogs, 3 dogs, was $60,000. That's what I paid out of pocket for my dogs. So have a financial plan, have insurance. The insurance plan that I had for one of my dogs that had cancer paid $40,000 in 1 year for her cancer surgery and her chemo. So if you can swing it, look into insurance. Yeah, or have a savings account for them. My little sister had a 22-year-old Chihuahua, and she would just put 15% of every paycheck into her Chihuahua's medical fund. Yeah. Yeah. That's not that hard, right? Have a vet, keep them cool, keep them skinny, have some money to take care of them because they're gonna have problems. Yeah. Any questions about that?
Do insurance companies charge more for Frenchies?
Oh my God, yes. Yeah. In fact, Odette came to me from a rescue with inflammatory bowel disease, with a congenital spine abnormality called spina bifida. with brachycephalic obstructive airways syndrome, her skin problems, and she'd had pneumonia, which is a thing that can happen with these guys. And so I got her insurance through one of the big insurance companies, and then she had an allergic reaction and they denied her claim. I'm like, sure, she has skin problems. Then she had a choking event and had aspiration but didn't have pneumonia, so it wasn't her typical thing, but they were like, nope, she's had pneumonia, we're gonna deny her claim. So for a year, I would try to get her claims approved, and her monthlies was $100 a month for her insurance. Finally, they never approved anything, so I canceled it when they told me that they were gonna bump her bill up to $130 a month. And I was like, no, thank you. Yeah.
On that note, do you have insurance companies that you tend to trust? You recommend?
The insurance community is changing all the time. The one that comes to mind that I like as an ER doctor, strictly because I'm an ER doctor, is Trupanion. They're really expensive, but it's what my dogs have, and it's what denied all of Odette's claims. They're very expensive, but what I like about them being an ER doctor is we can get pre-approval for big things. So if I present someone a $10,000 medical treatment estimate for emergency surgery, and we have to do it or their animal is gonna die, and they have Trupanion, but they don't have $10,000, because who has that in their bank account? I can call Trupanion and say, hey, I need to do this surgery right now to save this dog's life. Will you pre-approve it? And 24/7 Trupanion will say yes or no. So then we know whether we can do that or whether we need to explore other options for that patient.
That's great.
The other ones that I know of are all reimbursement based. So even if you get them, have a little chunk. If you can have $10,000 to $15,000 on hand for the animals for an emergency situation, that's ideal. And then they will just pay you back. The Nationwide, Pets Best, Lemonade, those are the ones that I have seen clients using even in the past couple of weeks. But just like for our own medical insurance, make sure you do your research. And ask your primary care doctors too. They might have a company that they have worked with that they feel like is very upfront and quick to reimburse. Yeah. What was your question?
As far as keeping them lean, you may have mentioned this. Do you have any recommendations on, because I know they have a little bit of exercise intolerance.
It's not like you can go run them on a treadmill. Yeah.
Do you have any recommendations as far as just kind of working with that breed or working with the breeds and helping keep them?
The lean thing. If they're not on a prescription diet, or if their prescription diet allows for it, this is gonna sound weird, but canned green beans are like a secret weapon because they have practically 0 calories. They have a lot of fiber, and so they can feel like they're still very full, but you're not giving them those calories. So you can try 10% of their meal volume as green beans. I get the low sodium sea salt and then I rinse them because they have a lot of sodium in them. My dogs love them. Odette gets nebulization treatments every night, so that's part of our bedtime routine. And while she's in her nebulizer chamber, yes, I have in my bathroom a chamber for my dog that has oxygen and a nebulizer. She gets little pieces of green bean so that she's a good girl and sits there and breathes in her treatments. Yeah, it works really good. Using things that are really low calorie for treats if the dog can tolerate it. I know a lot of dogs that really like the dried sardines. They make them for cats, but dogs really like them too. And they're very low calorie, so you can use those. Sweet potato is a big one in our house. Little tiny pieces of sweet potato. Everybody loves it. Cauliflower too, if they can tolerate it. You can do little pieces of cauliflower, which is low in calorie content. I wish somebody would manage my diet the way that my dogs are. I know every single calorie that they're getting. And then I have a chocolate chip cookie for dinner. Sometimes a chocolate chip cookie and a glass of wine. Like that's not right. Yeah. What else? I left us a lot of time for questions. So use me, I'm here.
I'm wondering back to the skin and the allergies, the environmental allergies, when a human has environmental allergies, there's a bunch of stuff you do. You don't wear perfume, you use different kinds of cleaners and things like that don't have perfumes. Do those things generally apply to animals, or is that kind of over extrapolating what humans might need versus what an animal might need to battle something that's environmental.
That's a really excellent point. Some of them are exquisitely sensitive to like cleaner scents or perfume scents. It's harder for us to test them for direct allergies for those things, but it's reasonable to think if your dog has severe allergies that you just don't use scented cleaning products. You don't use scented laundry detergent because they're laying and they're like right next to that all the time, whereas us are up and moving around, our face isn't smushed into the blanket that has a scented laundry detergent. I love that you brought that up, yeah. In my household, because we have a cat that's sensitive, she's a naked cat, and they have some problems with allergies and asthma, and we have the two smushy faces. None of our cleaning products have any scent. So when you walk into my house, there's hair everywhere, there's loud dogs, and you may notice a faint odor of a Frenchie. It's because I'm not using any, and no diffusers, no essential oils. Yeah. Ode du smushy face. That's what my house looks like. Yeah.
Do you ever consider like houseplants and also like outdoor plantings? Like if a person were to go really extreme about creating like a very safe sort of like backyard environment or even front yard environment for their flat-faced friends, I would imagine there are certain plants that you want to avoid just because they're already having problems breathing, or maybe even design.
Do you want to get like crazy?
Like
gravel and a shade over everything and AC units on everywhere. No, you know, we can make ourselves crazy, and I have made myself crazy trying to like subtly figure out any tiny trigger that's going to make Odette feel worse. But that is affecting my quality of life. If she wants to go lay in the sun in the backyard, I just have to be aware that it could impact her breathing, and I need to take steps if it does, right? Like, we have to let them be dogs. They're not a real dog, but they think that they are a real dog, and we want them to live a life that allows them to be a dog. Knowing that as their human parents, it's our responsibility to take action to limit things that we know are going to be a problem. And if there is a problem that we notice, we address it immediately. That balance of not making yourself crazy, not making your house covered in plastic, and not making the dog stay in a hermetically sealed kennel for the rest of its life with bubble wrap around it. Like, we have to make a balance of that.
Maybe I should carry it.
I mean, you could, but a lot of them can't breathe when you carry them, so I recommend a stroller. Yeah, they have some really fancy strollers, and then you can get one of the, so I'm going to overshare again because you guys know my finances. Now you get to know how old I am. I'm about to turn 46, and I started to experience hot flashes, and my husband got me one of the little fans that has a tiny misting system that you can just clip on yourself. And I was like, where's this been my whole life? For me and for the dogs, right? We get a stroller with their own personal fans on it. Yeah.
Just a question, probably 100% of the pet sitting that I've done always includes Dove Lewis as one of their emergency options. And so just in terms of emergency planning, if for whatever reason we're bringing in a pup that's having issues, would it be best to call, just letting you know, hey, we're coming in, like as we're coming in kind of thing?
You totally can. Okay. But we in the ER are extremely skilled at triaging. So if you like are stuck on hold, don't wait for us. Okay. If you can't get to your phone, don't wait for us. Just drive in, run into the front desk, say, my dog can't breathe, and we will whisk them away, get them cooled, get them in oxygen, get them sedatives if it's appropriate. We'll do all of that to work to stabilize them, and then we'll come and talk to you. Because ultimately, we love our clients, and we're here to serve you, but we're trying to keep those animals happy and alive, so they're our primary focus. Yeah. When it comes to respiratory stuff, or if you think that they have heat stroke, whatever ER is closest to you, get them there so that they can work to stabilize. Yeah. Don't drive 20 minutes to us if you're 2 minutes away from like Tannisbourne up in Beaverton. Go to that ER. Yeah. Or if there's a primary care that's open, down the block, run down the block with your dog.
Great.
Yeah.
Thank you.
Yeah, it's a great question. What else?
As for going back to just kind of like identifying triggers for allergies.
Yeah.
I know human dermatologists are doing like, they can really narrow down what people are allergic to. What I'm curious if that's happening with dermatology veterinarians now.
Yeah, we
Okay.
can.
Okay.
So we do the same skin prick test that they do in humans, where you go in and you get all the little allergens on your back, and then they test and see how much of a reaction you get. I hope you never have to go through that. It's not fun at all. But we can do that in dogs too. And funnily enough, like 70% of dogs that have environmental allergies are actually allergic to humans and human dander. Yeah, so we might be allergic to dogs, but they're also allergic to us. Yeah, so we can definitely do that. It does require sedation, because you can't ask a French bulldog to hold still while you poke them with like 50 needles. They're not into it. So we always recommend having a conversation, and the dermatologist will have a conversation with you about the risks and benefits of sedation for that particular test. Yeah.
Can I ask a question? It's not a respiratory or facial question, but our dog has one of those luxating patellas.
Yeah.
And our vet just said, there really isn't anything you can do to prevent it from getting worse. Or is there anything else we should be doing? Well, I've noticed she, at times, will just be doing a hippie hop.
Yeah, and then she'll stretch it out, shake it out, and it'll go back in. Yeah. They're more prone to arthritis as they get older. So just generally keeping an eye out for arthritis and working with your primary care for pain management once they develop arthritis would be important. There is a surgery that we can do for it, but it doesn't work great with Frenchies because they have the bowed leg stance.
Yeah.
It works better for like Yorkshire Terriers that have pretty straight back legs.
Yeah.
The braces don't work. Some people
I
will
was
say
wondering
knee brace.
about that.
Yeah. If they have like a tear of the tendons or the ligaments in the knee, a knee brace could be an option, but not so much for luxating patellas.
Okay.
Yeah. You just gotta let them shake it out.
Shake it out. Okay. Sometimes I just kind of rub it, and that
Yeah.
seems to help.
You can pop it back in too.
Yeah.
Sometimes if they fall, they can pop it out really far and stretch the tendons, and so they'll cry and then not put their feet down at all. And then in some of those cases, we do take them to surgery because the tendon has been damaged enough that the patella won't stay in its groove anymore.
Okay.
Yeah.
And signs of arthritis would be just that she wouldn't be easily jumping up on furniture and.
Well, the jumping makes me worry about their back, which can have arthritis too. So if you
Yeah.
see that, yeah.
Yeah.
If she's not as interested in cooking along on her walks, you know how they do the Frenchie trot and they just
Yeah.
want to keep going.
Yeah.
If she's taking breaks or
Yeah.
slowing down,
Sitting
then
down.
that could be a sign of
Yeah.
discomfort.
Okay.
If she's lame on that leg, even when she's not out walking or after exercise, if she wakes up in the morning and she's a little stiff, takes her a little while to get going, warm up, that could be a sign of arthritis.
Okay.
What else? Ask me anything. You know, I'll tell you. Age, finances, what else? How messed up my kids are. We have like 9 minutes left, so. Yeah.
I work in veterinary medicine, and as a tech, and over the years, I've noticed with the brachycephalics, especially pugs, I think, there's a lot of, in older age, it seems like there's a lot more like signs of dementia. I just have a theory that this is just a lack of oxygen in their entire life. How do you feel about that? I mean, I know it's not just that, but I just feel like they're never getting enough oxygen to the brain.
Like chronically hypoxic.
Yeah.
Yeah, I mean, maybe, sure.
Yeah,
In
I don't know.
humans that have had situations like have had to be on a ventilator or something and they couldn't get their oxygen saturations up, they are actually more prone to dementia as they get older. If they've had that happen any time in their life, or if they've had drowning, they're more prone to dementia. So, I mean, it could happen. Yeah, yeah. Frenchies never live long enough to get dementia.
It's very true.
Pugs sometimes.
Yeah.
There's like a curve that's like a peak and then a dip and then a curve for a pug lifespan. We say if they make it past 10, they're going to live to 17.
Yeah, I had a pug that lived till 15, 16.
Yeah.
And she is just gone.
My pug, she died when she was 16, and she turned into a mean dementia patient. She was like super sweet, but then when she developed dementia, she would try to bite anyone that she didn't know. And then she had intervertebral disc disease, so she had weakness in her back legs that progressed to not being able to walk in it. And then we were done then. But she was full of spice, that old lady. She was full of
So keep
spice.
them alive.
She smelled terrible.
Back to the eyes, and you were saying that some of those issues can really turn very quickly. I know we don't have an ophthalmologist at Dove Lewis.
We don't.
Where are they?
Yeah. So Northwest Veterinary Specialist has an ophthalmologist that can do emergency stuff. Who else? Maybe MedVet? Is it MedVet? I don't know. We have a list. So if you're interested in a list of specialists.
Pearl has one right now.
Yeah, Pearl, yeah. Oftentimes they don't come in because they live a pretty sweet life, like a very 10 to 4 p.m., 3 days a week shift style. It's a beautiful thing. So you can come into the ER, and us ER doctors, we're trained on stabilization techniques to help the patient feel a little bit better and make sure that things aren't getting worse until they can get in to see an ophthalmologist. And if they have an eyeball pop out, you don't need an ophthalmologist for that. An ER doctor can do that. Yeah. I don't think the ophthalmologist would know what to do for traumatic poptosis. Yeah, take it to the ER. What else? If y'all don't have questions, I'm going to make you show me pictures of your dogs. Just FYI.
Do you have any feelings or thoughts on surgeries or procedures or things? You talked about opening the airways when the animals are young. You're an ER vet, so you're not working with them, like you said, to set up with a primary care vet. They're the ones probably establishing that, setting that baseline of saying, okay, you've got an animal that's going to potentially have this list of problems, but there are a couple of things you can do to prevent this down the line. Are there any that just popped to mind of like, I would definitely recommend this, and this?
Yeah. If they're symptomatic when they're babies, do it early. Odette, when I got her, 3 days later, I scheduled her for surgery because her breathing was so bad, and she was 6 months old. So that's a little early than we would typically do it. We kind of want to think about doing it when they have their spay or neuter procedure around a year when they're full grown. But if they're symptomatic already as babies, then we just do it when they need it to be done. Otherwise, if they're okay, then we try to wait until they're around a year to a year and a half. Their body is full grown that way. Fergus, can I tell you more about my life? Fergus went to, he was a very virile young man, and he went to doggy daycare, and they said that he was trying to hump everyone, and that he couldn't breathe while he was trying to hump everyone. So he got kicked out of daycare. I went to pick him up, and the lady in the lobby was like, oh, you're here for Fergus? And the lobby is full, because we always did and we know everyone, because it was like a group daycare. Everybody came to pick him up at 4, and so I'm sitting in the lobby, and I'm just like, hi, talking to each other, and she's like, hey, Stacie, Fergus can't come back because he's humping everybody. She's yelling it over everyone else, and I was like, oh my God. I was like, okay. I grabbed my dog, and I cried in the parking lot with him, and I gave him a lecture about, consent and being responsible with your peers, and then we went and we did his nose, because if he's gonna try to die while he's humping other dogs, like, we need to do your nose right away. Yeah. So he was 8 months old. Yeah.
Can I just add something to the boarding and doggy daycare?
Oh yeah, that's a whole thing.
Yeah,
Yeah.
Especially boarding, make sure that you have an emergency plan and they are well versed in brachycephalic dogs.
Mm-hmm.
I've had experience like a dog that, a bulldog that just was so stressed out and would not stop barking, and that dog went into respiratory distress.
Wow. That's good to know.
And didn't make it, and it was awful. It was a young bulldog, and those people, the owners were amazing, and it
So
was just such a sad situation.
Well, that
So,
circles
yeah.
back to making sure that they're well versed at the hospital.
Yeah.
Like they're not stressed out or anxious in the car.
Yeah.
And adding
Every day, yeah.
kennel training, so
Yeah.
they're not stressed out in the kennel.
Right, yeah.
Yeah.
And that's kind of the beauty of what we do is go to the home. We don't take them out of their routine. We just
Yeah.
stay with them. And but one of the first questions I always ask: do you have a primary? Do you have an emergency? Like I need both of those before you actually leave your home.
Yeah.
So-
Well, and I would even add to that, if you feel comfortable with your clients, asking them to leave a credit card on file
Yeah,
with the
most of them
hospital
do.
that they prefer,
Yeah.
with like a limit.
Yeah.
When I go out of town, I say, here's my credit card, you can
Yeah.
spend this much.
Right.
And here are the people that you can contact if you can't get a hold of me.
Yeah, but we call that our oh shit plan. Like,
Yes.
I can't get a hold of
Oh,
you,
shit.
and I need to take your dog in.
Yeah.
How much can I spend? And am I allowed to put it on my credit card if you don't, have that on file
Yeah.
and all of that? So
Good on you.
yeah.
Mhm.
Yeah.
Mhm.